Good morning and welcome to the new edition of Dr. Lamba's Awakening Call. The catastrophic scale of COVID 19, accordingly to experts and normally thinking by anybody, could have been prevented. It was not something unpreventable. As soon as it was discovered that China was the originator, a concerted global action could have been taken. But what is there happening is a toxic cocktail of poor coordination, poor decisions, and this has been borne out by a WHO appointed independent panel for pandemic preparedness and response. And they agree that this series of bad decisions by WHO and by various governments led to kill at least 3.3 million people so far and devastate the global economy. And they call this report COVID 19 Make It the Last Pandemic. But is it really the last pandemic? Scientists say that more pandemics are around the corner, and last Thursday I talked about 12 viruses that are lurking to devastate humanity. Institutions till now have failed to protect people, and science denying leaders have eroded public interest in health interventions. But have the institutions woken up to their responsibility? And have the leaders a foresight of what's going to happen? This COVID pandemic, as I said, has been devastating in most of the countries. But then, worse pandemics, and not only concerning physical health, are on the corner. What I talked about, the 12 viruses which are going to destroy the physical aspect of humanity, there are others as well. And I'm worried about the coming pandemics, which are of a different nature altogether. We'll run out. The first thing that's going to happen is we are going to run out of the skilled personnel to treat COVID. As long as COVID rages, we are going to run out of the doctors, nurses, paramedical staff, pharmacists. Even they are suffering. A, their numbers are going to be decimated. B, they are going to be burnt out cases. And C, they are going to be mental health patients themselves. When you see the tragedy all around, after you are a human being and you are mentally disturbed, so you run out of your capability to face the issues. And then what happens? When the nursing staff, the medical staff is not there, COVID would assume greater proportion. And not only that, after the COVID is over, the Medicare would stand deprived of the capable people. Of course, even now we are seeing that suffering. And that's why some governments, like in India, they have said that the final year medical students should start working as doctors without going in for the house jobs and internships. In Canada, there are at least 2,500 foreign trained doctors who are working as cab drivers, real estate agents, and so on, because they have not been accredited to practice. And some of them have even passed the examination, but considering the fact that they didn't complete the residency, they cannot practice, they cannot work. Even if they want to work in a voluntary capacity. That was a shocking revelation to me. But anyway, this is one pandemic, the shortage of the medical staff and the paramedical staff that is going to be faced by the humanity. The second is the epidemic of illiteracy. The schools and the colleges are either closed down or partly being run on the basis of online classes. Now, virtual education can be supplementary and complementary, but it cannot be the real education. The real education is an interaction between the teachers and the students at one level, between the students themselves at the other level, individually, group wise. This peer interaction is important. And then peer interaction between the teachers so that they can discuss the problem of the students and come to a resolution. Now, with this online classes, with the virtual teaching, and there was a news that in India, more than 3 million students, and that is in the cities. We do not know, or we have not computed the number of such students in the villages who have no access even to the online teaching. So, what's going to happen is illiteracy and non adherence to the principles of education. This epidemic is going to be extremely harmful because whatever advances we have made in the field of knowledge will come to a stop and there will be regression. So first epidemic, which I'm worried about, pandemic, is the shortage of the medical staff, skilled personnel. Second is the problem of illiteracy, which is going to haunt not only the immediately coming generation, but the generations thereafter. The illiterate parents cannot understand the value of the education, and their children would suffer the same fate. The third pandemic is domestic violence. Are you aware that already there has been a 17% increase in the cases of domestic violence in Canada, 28% increase in USA, about 32% increase in Europe, and about India and other places, these things are not documented and they are taken as a part of everyday life. But they increase as seen in these countries where the domestic violence is documented is a hoary figure. What's happening is that when both husband and wife are together for a long time, unless there's a complete understanding, they get on each other's nerves. And violence is a way out of the frustration of both of them. They become less accommodating. The spirit of compromise is missing. The capability to understand the opinion and the view of the other is missing. And the result is outburst. And the cases of domestic violence are assuming the level of being an epidemic. They are being converted into pandemic is not far off. So this would be the third pandemic which we are, and it's a social pandemic, which will have social, economic, and cultural consequences. Then another pandemic, which none of the socialists have talked about, but I was shocked, and that is a child marriages. When the children have dropped out of education and the family incomes have shrunk, what do the parents do? At least in the countries like India, Pakistan, Sri Lanka, Thailand, Myanmar, and in Africa. When the parents see that their income is reduced, the children are at home roaming around, then what they do is that they consider the children to be liabilities. So the best way is to push the girls out, marry them as young as possible. In India, there has been a data collected, part of it's true, that compared to 2019, there has been an increase of 33% in child marriages between June and October of 2020. These 4 months only, there was an increase of 33% in child marriages. Children as young as 10-year-old were being married. And in Pakistan, the situation is still worse. The increase has been 45%. Now, when the child marriages increase, the consequences are horrible, both health and social. There's been evidence also, apart from the child marriages, that there's increased case of child trafficking and child labor. So the child exploitation in all aspects, whether it's juvenile prostitution, whether it is trafficking, whether it is child labor, it has increased. And naturally, when the parents cannot or do not earn enough to make both ends meet, they make the child work as well. So these lockdowns and these pandemics have this absolutely shocking social, economic, and then ultimately political aspect as well, because they'll be unable to think and react, and they will be reduced to the level of dumb driven kitten. Then there's another one which shocks me is the epidemic of the mental health issue. Mental health cases are increasing all over. When the people are not going out, they have a mental health issue. Domestic violence increase, mental health issue. Child exploitation, mental health. All these pandemics, they contribute to the mental health. And then it's terrible. Now imagine the third epidemic, this mental health, rather the fifth epidemic, mental health, is being aided by life-saving treatments that are linked to fungal growth, black fungus. People are self-medicating. The latest report in USA Today shows that in India, because people are self-medicating, taking steroids, there's an increase in black fungus, which affects the brain. And then this also adds to the mental, but mental health is an issue, which is being aided and abetted by diverse factors. And that one is going to be really a problem. And thirdly, apart from these five major epidemics, the third issue is that what itself, humanity as a whole, is going to have an immune system, the people, which will not be able to fend off the other diseases, maybe small, even flus and chikungunya and others. And it's going to happen that the survivors after that, when they face with any medical issue, the mortality rate would be 50%. There's a comment by Mr. Singh Jaspal. Wonder if these sexual child marriages are not the leader in India. Well, if these figures have been given out by the PMO's office, you can be sure they are known. But what happens is that our leaders always try to gloss over such facts. Until and unless they become horrible, they cannot be ignored, they're glossed over. We try to push all the negatives under the carpet. Basically, our leaders are ostriches. They bury their heads in the sand. Only when it's a question of do or die, they wake up. Even when they don't do anything, they try to run away. So, what you are saying, Mr. Jaspal, let me tell you, leaders are aware. The point is, are they prepared to take action, which they are not? Mentally, they are in a state of stupor, if not coma. So, the point is that we say that this is the last epidemic, which is misleading the people because it's not. The other epidemics, medical ones, are lurking from the corner, and the non medical ones, the social ones, the political ones, the cultural ones, are also there. The only problem is that we close our eyes to the danger. We are not prepared to look at the danger eye to eye. And since we are not doing so, we are not prepared to face the new dangers. It's easy to say, but can you believe the way people are dying and even the rivers are being clogged with dead bodies? Now look at it. Another problem, in India at least. 1,500 dead bodies in Munger, 750 dead bodies in Buxar, more than 1,000 bodies in Muzaffarnagar and in Narmada. Now, all these waters would be poisoned. The dead bodies are giving a stench. People are moving out. So, is this not going to cause another problem? And if it does, is not another epidemic around the corner? But I can't blame the government as well. Unfortunately, we have forgotten, we talk about the shortage of beds and everything, and that is bypassing the issue. Beds do not treat patients. It's the doctors, nurses, and paramedics do. Before the COVID, for example, in India, the medical shortage was about 76%. And now it's going to be 89%. That's the shortage in India of the specialists. And India is the only country in the world which can produce a few lakh young frontline workers in a few days. You just change the regulations. There are 2.2 lakh nursing students who have finished their training. And simply they are not being employed because they have not got the results. What difference does it make? If they have appeared for the examination, assume that they have passed. Use them. And your ICU serving paramedical students are there. Those are professionals who will work it out. The second hurdle is the specialist doctors. 25,000 young doctors are ready to finish training in various medical and surgical specialties. Say that they have assumed, they have worked, they have submitted their thesis, their papers, only the result, the formal result is out. Till now, the reports are, and the data shows that hardly 0.1% students fail at that level. So what are we waiting for? Why not use them? It's better to have 99.99% doctors than to have a zero doctor. 1.3 lakh doctors are sitting at the home made. And what are they doing? They are waiting to secure a seat in the postgraduate. At least they're MBBS. Use them. So what I mean is that we are not pragmatic. And that's only about the first epidemic. The second epidemic, why can't we have the schools open where there's social distancing is maintained? You need not have education only as a virtual education. Have schools with 10 students, 15 students in a class, and you use a mic for that purpose. But at least there will be interaction. So all these pandemics and epidemics, social, cultural, so political, and medical, are treatable, are preventable. We need two things: imagination, initiative, will to do it. If we have got will to do it, we'll do it. Otherwise, these pandemics are just around the corner, ready to hit human beings, ready to hit the world. But are we prepared? No, we are not. And that's why I'm saying we need to wake up from lethargy, come out of the state of coma, mental coma, and see things what they are, rather than bury our heads in the sand and wait for the disaster to strike. Act today before it's too late. Thank you.